Give some latest COVID numbers from Colorado. In the last day, we've had 1,838 cases. We currently have 922 hospitalizations. That is the highest number that we've had since January. Now, we had last week 921, but before that, we didn't have these kinds of numbers since last January. So a 41 increase. We are concerned with the increase in spread. Everybody should be very careful. First and foremost, get vaccinated. If everybody was vaccinated, we simply wouldn't be here. And just to put a perspective on that, of the 922 people hospitalized, 710 are unvaccinated and 212 are vaccinated. So that means that 710 come from that 30% of the population, 25% of the population that isn't vaccinated. And we have only 212 that come from that large group of the population that is successfully vaccinated. If everybody was vaccinated, just to be clear, and we saw the same effect, even if, by the way, and there's only upside, because if everybody's vaccinated, the virus wouldn't be spreading like it is. But if everybody was vaccinated and for some reason the virus is still spreading as it is, I projected the numbers of hospitalizations we'd have about 265 people in the hospital. So if that last 25% was vaccinated, instead of having 710 people from that last 25%, we'd only have like 40 or 50 if it held up at the same rates as we're seeing. Not to mention, it would actually be less because, of course, there's less spread and contagion among people who are vaccinated just too. So I just can't emphasize how important it is to get protected. This simply wouldn't be a crisis if more Coloradans stepped up and got vaccinated. That's what Dr. Munn will talk about. There's an added increased benefit from the booster, no question. The first 2 doses are even more important, but on both a personal level, who wouldn't want to increase their protection? 5 or 10 or 15% more, especially as it wanes after 6 months. But at the population level, that also makes an impact as people get those boosters, and I'm glad that Colorado is leading the way in doing that. We are down to 149 ICU beds across the state. The single biggest thing that every Coloradan can do to make sure that there's an ICU bed for you, if you need it, if you have a heart attack, a stroke, is get vaccinated. If for some reason you don't care enough about yourself, you don't love yourself, you don't want to protect yourself, I hope you care about your family and neighbors and others enough to get vaccinated so that we do not exceed our hospital capacity. Please do that. Our state, our nation is counting on you to get protected. We are now at 77% of Coloradans have gotten the first dose of the vaccine. We're just over 70% of eligible Coloradans who are fully vaccinated. These numbers continue to put Colorado in a higher top tier of states with regard to vaccinations, but unfortunately, as we see in our hospitalization numbers, there are still large numbers of unvaccinated people being hospitalized. 710 Coloradans who chose not to get vaccinated are in the hospital for no good reason. Some won't even make it. Some will die. Some will make it, but it'll be a harrowing few days and weeks. And we wish them well in their recovery. But we also wish that their misery helps get the message out about why people should be vaccinated. They simply don't need to be there. Of the 922 hospitalizations, 17 of them are 0 to 11-year-olds. We're within our pediatric capacity, and only 9 of them are 12 to 17-year-olds. I would point out there's no reason for anybody 9 to 17 to be in the hospital for COVID. Everybody 12 to 17 can be vaccinated. There are only 9 age 12 to 17 in the hospital. There should be 0 because everybody 12 to 17 can be vaccinated. It is very close to 100% effective at preventing hospitalizations for that age group of 12 to 17-year-olds. So we certainly wish the 9 of them well. We hope that everybody recovers. I also want to be clear, there are currently 0 Coloradans hospitalized for any type of vaccine side effects. So that's also a good number to put in contrast, that there's 710 unvaccinated Coloradans in the hospital for COVID. There are 0 people hospitalized for any type of side effect from the vaccine. If you haven't gotten it yet, do the math, take a look, get protected for yourself or others. We've got to end this pandemic. First and second doses are, of course, incredibly effective, but booster shots are also going to play an important role. My parents, 77 years old, got them. I plan on getting mine after it gets finalized for Moderna. Lieutenant Governor has received hers, and she will talk about her experience. Recently, the CDC offered the full guidance on who should get the Pfizer booster after 6 months. Everybody age 65 and up. Anybody who works in a long-term care setting, anybody with a pre-existing medical condition of any age, and anybody who just works around others. So if you work in a grocery store, a retail store, anywhere and you got the Pfizer vaccine 6 months ago, get that booster, it increases your personal protections considerably and reduces your chance of getting the virus, especially with the virus so prevalent across our country, with the hospitalization rate so high across our country. And of course, Colorado is seeing that as well. I'm proud to say Colorado is doing better than some on boosters. Nationally, we're at 3.2% of Americans have gotten their third shot, their booster. We are at 4.8% of eligible Coloradans, and we expect to see that increase. It is easy to get. And I would also point out that if you did get Moderna, you can receive a booster if you attest that you have a weakened immune system. And I certainly would encourage people in their 70s, 80s, 90s to do that. People in their 70s, 80s, and 90s are immunocompromised vis-a-vis this virus. The statistics are exceptionally clear with regard to that. Next week, the FDA, on October 14th and 15th, the FDA will formally discuss boosters for those who got Moderna. And finally, Johnson & Johnson. I know folks are waiting for official word. Some have moved forward on their own with vaccinations. Others are waiting official word of the FDA and CDC. We are thrilled that they are finally meeting October 14th and 15th to offer the formal guidance on boosters for Moderna and Johnson & Johnson recipients. With that, we have our very own Lieutenant Governor who received the booster yesterday. She's going to talk about her experience. I am very glad that she is protected because the last thing I want to have to worry about is the health of our very own Lieutenant Governor, who's in exceptional shape, better than me, Diane Primavera.
Well, I don't know about that, Governor, but thank you. And, I'm happy to share my experience in getting the COVID-19 booster shot yesterday and hope that my story will inspire others to do the same. Over this last year, COVID-19 has taken so much from all of us. We were isolated from our families and friends, forced to work and learn from home, and suddenly mundane activities like going to the grocery store even became high-stakes situation. So that's why when the first vaccines were approved back in December of 2020, I was overjoyed. Finally, it felt like we could see the light at the end of the tunnel. So as someone who's been diagnosed with cancer 4 times, and a woman in her early 70s, and a grandma to 3 beautiful grandbabies who aren't old enough to be vaccinated, I knew that I had a responsibility not only to myself and the people I love. I had the responsibility to follow the guidance of leading medical experts and get the life-saving vaccine. And when it came time to get my booster shot, it was those same motivations that made me roll up my sleeve yesterday for a 3rd time. So when I received my shot yesterday, I was in and out in about 20 minutes, drove myself to and from, and I've really experienced minimal side effects since then. Soreness, fatigue, body or muscle aches, headaches, or chills are all very common side effects of getting the vaccine. And that's true whether it's your 1st, 2nd, or 3rd dose. But yesterday, I have to admit, I'm a little needle adverse. Always hated shots, but I went in and it was really painless to get the shot. And today, I would say that the only thing I'm experiencing is a little lethargy. I'm a little low energy. I don't feel like vacuuming or doing dishes this evening, but I'm not sure that that's a side effect of the vaccine. I think I just don't like to vacuum and do dishes. So, I know eligible Coloradans can get their booster dose anywhere that provides vaccines. So find a location near you at covid19.colorado.gov/vaccine. That's covid19.colorado.gov/vaccine. So in conclusion, we know that every shot in the arm is another step toward a Colorado future that's free from this terrible virus, which is why I want to encourage everyone who's eligible to go get their booster as soon as they can. And of course, 1st and 2nd doses are essential to stopping the spread of COVID-19, and they remain highly effective in fighting the virus, preventing severe symptoms and, as the governor said, hospitalizations. But with the severity of the Delta variant and the dangerous decision by far too many Coloradans to not get vaccinated, we have to do everything we can to protect ourselves and the people around us, like my little vulnerable loved ones. Protection from the vaccine gives me the freedom to safely do the things that I love most, like play with my grandchildren, go dancing, which helps me balance my life, or hit balls on the golf course. So that's why that's the same freedom that I want every Coloradoan to have. The choice to go unvaccinated doesn't just impact your life, it creates a ripple effect that impacts those around you, even people that you may never meet. So as the governor said, Colorado is well on our way toward a strong recovery, thanks to our strong vaccination rates, but I know that we can do better. So Governor, with that, I'll turn it back to you.
Diane, I don't like to vacuum or do the dishes either. I think what we really need is a vaccine that makes you want to do the dishes and vacuum. That would be an exciting one, and people would like that. But thank you for your testimony. I am so grateful that you're protected. I'm so grateful my parents are protected. I'm so grateful that we now have over 4% of Coloradans who've gotten the booster. And some of you out there are wondering whether a booster is something you really need. I want to be clear that the data could not be more clear, and that, of course, a booster will increase your protection substantially. Reduce your risk of hospitalization, reduce your risk of contracting the virus, and also reduce your risk of giving it to others. If it's been 6 months, approximately 6 months, get that booster. And especially if you've gotten Pfizer, and then we'll get the formal guidance on Moderna and J&J in a week. But again, if you don't want to wait, if you've gotten Moderna, you can simply attest to having a weakened immune system. This is going to be a big part of making sure that we have a lower death rate. We've been successful so far in Colorado in having one of the 10 lowest death rates in the country. We want to keep that up, most of all, because I know we love life and we love being Coloradans. Beyond the work that the state has done, and I've talked extensively about our equity clinics, our buses to get more people vaccinated, we've seen so many employers step up, private sector, public sector, going above and beyond to protect their employees, their customers. And they're really doing the right thing for the people they serve, for their own staff. And they're also playing a role in stopping the spread of disease in our community. Now, the FDA is going to discuss the Pfizer approval for 5 to 11-year-olds on October 26th. The date has been submitted. I wish they would meet earlier to do that, but I'm hopeful that they act expeditiously on October 26th. But until then, we particularly have to make sure that we protect our kids who don't have access to the vaccine under age 12. Next week, the FDA is meeting to discuss people who got the Moderna and Johnson & Johnson vaccine booster. I would also point out teachers are in that group who are fully eligible for the booster if they got the Pfizer vaccine 6 months ago, which they were eligible for. So many teachers are getting the third dose of Pfizer, and after we receive the Moderna Johnson & Johnson updates, we expect that many teachers will also be in the forefront of getting protected with the booster doses. I want to highlight that we are joined by one of Colorado's leaders on COVID safety, Superintendent Rico Munn. Superintendent Munn has gone through extraordinary steps to protect their staff, protect their workers, protect their students, including vaccination clinics at their high schools, and making sure that staff are fully protected. With that, I'll turn it over to my longtime friend and unfortunately a Raiders fan, Rico Munn.
Governor, you wound me. Longtime Steelers fan, let's be clear.
If it ain't the Broncos, it ain't the Broncos. That's what.
And for the record, I am also in much better shape than you, than Lieutenant Governor Primavera. She and I are both there. Thank you so much for having me and for giving me the chance to talk about our work here in the Aurora Public Schools. Here in the Aurora Public Schools, our job is to accelerate learning for every APS student every day, and we take that work very seriously for our nearly 40,000 students. We serve a very diverse and complex community. One of the things that we know is that in order to accomplish our job, in-person learning environments must be safe, secure, and very rigorous. And it became clear as we've gone through this COVID crisis that we have to do everything we can to protect that in-person learning environment. So back in May, we announced to our staff and to our community that once a vaccine was fully approved, there would be a mandate for our staff to be fully vaccinated. And as that approval came early this school year, we put that in place and gave our staff 45 days to comply with that. Tomorrow is the deadline for the staff compliance, so we don't yet have final numbers. But what we know is that 96% of our licensed employees, our frontline educators, our teachers, our principals, are fully vaccinated. We expect that number to go up as we reach that deadline tomorrow. And also, we also know a number of our staff are partially vaccinated, and so those numbers will increase. We have a few staff members who have appropriately qualified for an exemption for medical or religious reasons, but we're incredibly grateful to our staff for stepping up and responding to this need for our students to be protected and have protection in our classrooms. We have sponsored a large number of vaccine clinics throughout the district where healthcare providers and partners have come in and used our facilities and used our staff to administer thousands of doses of vaccine to members of our community. We've also had in place a requirement for all of our student athletes that they either be vaccinated or get regular testing, because we know that vaccination is the key to making sure our students are healthy moving forward throughout this process. And so we want to make sure that they and their families have a clear option to protect themselves as they are engaging in some of these higher risk activities. As we know, an undiagnosed respiratory condition can be a dangerous situation as it relates to COVID-19. So we've been very aggressive in our work to make sure that we are putting vaccinations in place and protecting our staff, our students, and our learning environments. As we continue to learn more about COVID-19, we're also continuing our partnership with COVID Check Colorado to get regular testing. And we've recently signed up with CDPHE for regular surveillance testing at our schools. And as we get more of that coming online, we know that that information will help protect our learning environments and also encourage more people to get vaccines wherever possible, whenever possible. So thank you, Governor. Thank you, Lieutenant Governor, for your leadership on these issues. And we're happy to be part of finding solutions to making sure that Colorado stays healthy.
Thank you, Rico. And, the vast majority of Coloradans doing the right thing for themselves, protecting themselves, rolling up their sleeves, getting the first 2 doses of the vaccine. And many people are, of course, proceeding with the booster to protect themselves. But we are still in a pandemic, and there are still too many Coloradans who haven't yet made the choice to protect themselves. And if they're our friends, our family, we want to encourage them with love. We want to show them the data. We want to make sure that we enlist their help in getting out of this pandemic. Some people were hesitant, wanted to wait. Now's the time to do it. Get vaccinated first and second. And if it's been 6 months, go ahead and get that booster. It's going to take all of us working together to get through this pandemic. We're mostly there. A lot of the pain, suffering, and loss is unnecessary at this point, which makes it extra difficult and extra challenging and extra painful for me as governor, knowing that if simply more Coloradans would get protected and get vaccinated, we wouldn't be having anything close to this level of hospitalizations or this level of loss. With employers like Aurora Public Schools leading the way and so many others in the public and private sector to help vaccinate more people, protect more people, I know we're going to emerge stronger than ever before. And I want to thank everybody for helping us get there. With that, happy to open it for questions.
To all members of the media, if you would like to ask a question, please use the hand raise function or message me, Gov Office Media Line, and I will assign you a place in line. But our first question goes to Jessica Seaman. Go ahead, Jessica.
Hi, Governor. I know that I think it was over the weekend, you had ordered schools to report more data about COVID-19 to the state. What data are you looking to get that you don't already have? And what will it tell you?
This is to identify school-based outbreaks. So it's not about particular students. It is about particular sites, just making sure that if the schools themselves aren't made aware of it or don't notify the state, that we can make sure that parents are aware when there are outbreaks at their school and that schools can take the adequate precautions they need to avoid further spread of the virus.
Can you clarify how that would be on top of what we already have on school outbreaks? Would this look more?
Yeah, it's mostly overlap with what we already have. I think there's a few instances where there's concern that reports that were required we weren't getting or the state wasn't aware of, or students that might be affiliated with the school where the school themselves didn't know that a student had it. So it's just it's really just to catch a few cases that might have been falling through the cracks. It's consistent with probably 95 to 98% of what's been happening anyway, but we just wanted to make sure that as few parents as possible were in the position of not knowing if there was an outbreak at their kid's school.
Okay, thanks.
Our next question is from Sarah Flower. Go ahead, Sarah.
Sarah, how are things in Durango?
All the way over here. The line's not as great. Governor Polis, my question is to you here, as we've talked a lot about the idea of mandating masks as a layered approach in addition to testing and vaccines. But for those school-age children here, schools, districts across Southwest Colorado, majority of them are leaving it up to parents' choice, which a month into school now, we're seeing a very high positivity rate among school-age children. As part of the layered approach, will you be mandating masks in schools? And if not, what will that metric look like to get there?
Well, as we indicated, we are not in danger of exceeding our pediatric hospital capacity at current levels. We monitor that regularly. The most important step for parents of kids 12 and up to take is to get their kids vaccinated, because there is a next to zero, if not zero, hospitalization rate for vaccinated 12 to 17-year-olds. And as we get the vaccine approved for 5 to 11-year-olds, We want to make sure that parents know that that has a tremendous impact on protecting their kids, far greater than masks. You'd much rather have a 14-year-old that was vaccinated than a 14-year-old wearing a mask. The vaccine offers a much, almost uncomparably higher level of protection. Now, again, for people that aren't vaccinated, we encourage safety precautions like wearing masks, opening windows, social distancing, a number of common sense steps that you can take. Many of them are the same for adults. But frankly, there's nothing that competes with the level of protection that the vaccine provides.
Our next question is from Seth. Go ahead, Seth.
Hi, Governor. Seth, the Gazette. 2 questions for you. One, can you place that 149 ICU bed number into context from previous points in the pandemic? And 2, can you elaborate on how you calculated or where that 265 number for people who'd be hospitalized if everyone was vaccinated, where that number came from? Thanks.
Yeah, so the second one is very simple math. And when you extrapolate that we're about 75% vaccinated, 3/4 vaccinated. So from that 25%, we have 710 hospitalizations. If you added on 25% to represent that they were vaccinated to the current number of vaccinated in the hospital, which is 210, you get something like 265. So that would be the maximum number of people that would be hospitalized if everyone was vaccinated. Frankly, in real life would be lower because it also reduces the spread of the virus. So just to be clear on more so you understand the math, the very simple math that's being done, extremely simple. And that's about 75% vaccinated. It's about what it is, right? It's 77% with first, it's a lower than 75 with both, but you can use that to make the numbers easy. And you say, if that 25% had the same hospitalization rate as that other 75% who is vaccinated, then you can extrapolate what the total number of hospitalizations in the state would be. So that's what that is. What was your other question?
Can you place that? You said there are 149.
So, yeah, so I can get that back. It's the lowest we've had in some time. Now that's a function largely of the COVID increases, but also of the seasonal non-COVID increases. So this is a busier time. There are more people in the ICUs than at other points during the pandemic. So it is a startlingly low number. We're happy to get back to you with when or if we were at that number before. But it is largely attributable to COVID. And we'd rather, of course, as I said, have 260, 270 people hospitalized for COVID if everybody was vaccinated. And then there wouldn't be anything close to capacity issues in the hospitals. But because of this over 700 unvaccinated people flooding the hospitals, we have very few ICU beds left relative to the norm. And we're happy to give you that in the context of what we've experienced throughout this pandemic.
Our next and final question is from Erica Meltzer. Go ahead, Erica.
Thank you. This question's for Superintendent Munn. You had mentioned that you recently signed up with CDPHE for the surveillance testing, and there have been a lot of school districts that have not been eager to go that route. And so I was wondering if you could talk about how you see that working with the COVID check, what made you think this was a good addition for your district?
Well, I think we all need to remember that we are still learning and evolving and growing in our understanding of COVID. As we see new variants, as we see different things happening around the world, our base of knowledge continues to grow. And so we see this as an opportunity to grow our base of knowledge, to grow our understanding of what spread and transmission may look like. And I think it will also be very helpful to get a sense of what it looks like before and after a vaccine for 5 to 11-year-olds. It will help us understand what that data transition looks like.
Thank you.
Thank you all for joining us. Are there any additional questions? Seeing none, again, I want to send an urgent message to Coloradans who haven't chosen to get vaccinated yet. This pandemic won't end without you. You can't protect yourself without getting the vaccine unless you want to lock yourself in your home and not go out. Get vaccinated, get protected for yourself, for your community, for your state, for your nation. It's a simple thing you can do and help make sure that you're there for all your friends and family. Let's get protected, Colorado. Thank you for joining us.